Welcome to today's Place and Wellbeing Outcomes Masterclass. It represents our second masterclass in a series about place and place-based approaches. My name's Irene Buteman and I'm the Place and Wellbeing Partnership Lead at the Improvement Service and Public Health Scotland. And I've been the lead on the Shaping Places for Wellbeing programme for the past 3 years. What we're going to do today is I want to give a little bit of a run through, very quick summary of what Masterclass 1 entailed, only to give it some context to the fact that we're here today to talk about the place and wellbeing outcomes. Then we'll get into the meat of why we have a set of place and wellbeing outcomes and what they are, what do they consist of, and then we'll look at the use of them and how we've used them in the Shaping Places for Wellbeing programme. I'm very interested to hear of others and how they've used them, as I say. So to begin with then, the previous masterclass is now up on the Improvement Service website, able to be viewed. And what we covered on that particular masterclass was a far broader context to place-based approaches. We discovered what did we mean by place, why it matters, the impact that the places that we live, work and play have on our health and well-being, the well-being of our planet and on inequalities. What does it mean to take a place-based approach? And then we looked very broadly at the work of the Shaping Places for Wellbeing programme in supporting taking a place-based approach in Scotland. To highlight a couple of bits of context that I think will help for today, we discussed, well, who should be taking a place-based approach? Who do the place and wellbeing outcomes apply to? And at that, we were highlighting just our own initial thoughts for the work, highlights there that this is far more than councils and the NHS. This is all sectors that are involved in places, the third sector, private sector and communities. And it also isn't just sitting at a local level. We're up at Scottish Government level and we're looking at impacts on strategic decision making as well. Likewise, an important aspect for looking at the place and wellbeing outcomes today is looking at what are the key parts to a place-based approach, which we covered in general in Masterclass 1. The importance of looking at what's happening in a place, what's happening to the people there and what they're experiencing, the importance of knowing all the features that we need to get right in a place for it to have a positive impact on those using it. And then how do we bring that into decision making? So that was the overall context for Masterclass 1 with a lot more detail given in that. And I would encourage you to go back and have a look at that if you haven't already. And you want the overall context for where the place and wellbeing outcomes today sit within that overall place-based approach. So on to today's topic and the place and wellbeing outcomes then, and why we have them and what is it that we use them for. So adding into that slide that we've just been looking at, if we're looking at place and the features that we need to get right in a place, that is directly where the place and wellbeing outcomes slot in. They are a crucial part of taking a place-based approach. We have the importance of what people are experiencing, so data, inequality data, as you can see there. All of that will be covered in more depth in Masterclass 3. And then when we look at the importance of bringing the place and wellbeing outcomes and data into decision making through place and wellbeing assessments and briefings and leadership and governance, we'll be managing to look at that in Masterclass 4. All of those will be available before the end of the year. So our focus today is that middle point and that crucial role that the place and wellbeing outcomes play in taking a place-based approach. Where did they come from? They came from this group, the Place and Wellbeing Collaborative. Now, this is a group, the organisations that are represented are up on the screen, that came together in 2019 as a result of a lot of work ongoing around the review of public health, the review of the planning system, a new ask on the national planning framework to look at health and wellbeing and to look at reducing inequality, and a realisation that all of these organisations had a shared ambition to improve the places where we live, work and relax because of the impact that they have. And that overall impact that it's having on the health of Scotland is covered fully in Masterclass 1. So what we did as a result of coming together was we identified the fact that there was no consistent set of features that were felt to be right when you were considering what are all those features that we need to get right in a place. They weren't set out consistently and comprehensively anywhere. So the first thing that group did was it came up with the place and well-being outcomes. Now, when I say came up with, there was a process that it went through to develop them. The very first thing was it looked at evidence. Evidence was crucial. These are not a set of outcomes that have been brought together as a result of some workshops with people in them over a series of weeks. These are based on evidence and research, factual research that has been undertaken to say if you get these outcomes right in a place, then you can enable the well-being of people, you can deal better with equality and achieve better equality, and you can enable us meeting our net zero emissions and sustainability. So that ability to deliver on the triple win. There are 13 outcomes in total, and they sit within the 5 themes that you can see coloured there on the screen. An important aspect to highlight now is that in the middle there is people, because it's the impact that all of these different outcomes have on people that is crucial. It impacts on their social interactions, their social inclusion, their ability to take part in economic life, and to take part in life and physical sort of environment as well. So they all result in an impact on people, and they all have a crossover of how they do that as well. And I'll go in a little while into a little bit more detail on the actual content of those outcomes, which I'm delighted to do because I generally don't get the time to go into that kind of depth about them and the evidence. So it's just a lovely opportunity to explain that. So as I say, what they were based on was evidence that came from the same evidence resource that was used to shape the Place Standard tool. So that was an evidence resource pulled together over 6 years ago by Public Health Scotland, looking at different research and pulling all of that together. And that was recently updated in light of us having developed the place and wellbeing outcomes and doing the Shaping Places for Wellbeing work as well. But it was also based on what was coming out from the World Health Organization and other UK public health bodies, particularly Public Health England at the time. And an important aspect, as I was saying there, is not to see these outcomes as sitting on their own, that you can sit and deliver on one outcome because perhaps you deliver a housing strategy. So you think, oh, I can deliver on the housing and community outcome and I'm ticking the box. They are all linked. We need to be looking to deliver on all of the outcomes to make sure that we are aware of any unintended consequences of the work that we're doing. And we'll go on a little bit more to that in a little while. So another important aspect to come to before I even go into the wording around the outcomes is just some clarity about how they relate to the Place Standard tool. I've said, they're both underpinned by the same set of evidence, which is fantastic, thus the similarities in them. However, the outcomes themselves are the evidenced end result that we want to achieve in all of our places, the features we want to see everywhere. And that, by definition, is outcomes and outcomes-based working. The Place Standard tool is about how we engage people in conversations about their place and capture their perceptions on how they feel about those outcomes and how they're being achieved. So they are a set of questions that are lined up to be able to have that conversation and to capture that absolutely crucial community insight, which forms a different part of a place-based approach. So the two have their similarities, they align and they work together, but two very different parts of a place-based approach. So to get into the wording, you'll probably be glad to know I'm not going to go through the wording of all 13 outcomes, though I'd love to, but we'd maybe need an hour and a half for that, not a half hour. So I'm just going to pick out a couple and focus in a little bit about just the depth of wording that's there and the evidence. Now, I'm pulling this from a set of place and wellbeing outcome briefings that are up on our website for all of the place and wellbeing outcomes. And I've pulled out the one on active travel first, primarily because in our work we found that the active travel outcome is something that is very pertinent at the moment, so it seems a good one to focus in on. So just to look at the kind of wording that's there, what it is saying is that active travel can have a positive impact on people when everyone can easily move around using good quality, accessible, well-maintained and safe segregated wheeling, walking and cycling routes, and have access to secure bike parking. And then importantly, not just that everyone could do that, but that everyone can wheel, walk, cycle through routes that actually connect homes, destinations and public transport, that they're segregated from and prioritised above motorised traffic, and that they're part of a green network. So the importance of the active travel and the importance of the connections. And something that we've done in particular for the active travel one is explaining the meaning of the word active travel, because we found many people go straight to cycling in their minds, where walking being the one aspect of movement that we all use, it's so important to highlight that it encompasses a range of different means of getting around. So having defined what we mean by active travel and what that aspiration is, and we're not saying that we can achieve that all over Scotland, we're fully aware of that. We have many rural areas of Scotland that can't achieve that, but the desire is there to have that for everybody. That is the outcome that we want to be working towards for people. The reason to want to work towards that, the reason in even a rural area to be saying this is something that we want to be improving upon, is what the evidence helps with. And the briefing papers pull out a snapshot of that evidence and research that we have been using. So in this instance, saying, active travel can improve health by increasing physical activity, weight loss, and reducing obesity. Equally then, it's associated with a reduced risk of death. So it's impacting on all those figures that I covered in Masterclass 1. It's also able to increase social interactions and is associated with, therefore, improving mental health. And it can minimise harms to health by reducing motorised traffic as well. Other evidence is that safety is a key barrier to increasing active travel amongst women. And that walking or cycling to school helps children to achieve a healthy weight, with the benefit of being actually greater for children in deprived areas. People are also experiencing transport poverty often and are forced to run a car despite having limited resources. And this is particularly problematic in rural areas. So another bit of evidence that backs up the reason for promoting and intervening to have more active travel. It also can provide benefits to local economies. A lot of research around its impact on our local high streets, that people spend more money if they have arrived by a source other than a car. And also that there's an increased public support for investment in walking and cycling. And understandably, perhaps, particularly amongst people on low incomes, those half of all households without access to a car. The second one I wanted to look at, and as I say, I'm only going to look at the two, but I wanted to then pull out something quite a bit further round on the ring and to look at stewardship and influence and control, because it's something that I think we're all at some point engaged with or are part of, where we are actually going out and finding out what communities, gaining community insight into the decisions that we're taking. I'm not going to run through all of the wording there. All of these are available for you to look at, but the gist of that is that influence and control can have a positive impact on people when everyone is empowered to be involved in a place. I do wonder at times, do we realise that when we're out consulting, that rather than simply consulting to make sure we have a community's input, that mere process is actually improving people's health and well-being. The evidence that sits around the importance of having that sense of influence and control is that where we have that sense of control, it's described as believing that you can influence and shape your own life. And it's beneficial for mental health and for the quality of our life. And where we do the opposite, and people feel powerless or feel that lack of control over the environment that they step out of their door into, that can be leading to chronic stress. So we start to look at the health implications again. That lack of control can lead to poorer health outcomes, therefore, such as increased risk of heart disease, depression, anxiety, and stress. On the other hand, where we feel a sense of control, that can lead to more empowerment and a sense of purpose. So a high sense of purpose has therefore been associated with a reduced risk of all-cause mortality and cardiovascular events. So again, all linking back to something as simple as the sense of influence and control that we are enabling in our decision making, having that impact back to the really terrible stats that were in Masterclass 1 about our health and well-being in Scotland. Empowerment can also reduce social isolation, so that can be really beneficial for our mental health and well-being. But when we get into particular groups, such as people with a long-term health condition or a disability, those groups can feel even less empowered in decisions about their neighbourhood. Likewise, people on lower incomes tend to have a lower sense of control compared to people on higher incomes. And the result that all has is that people living in socioeconomic deprived areas feel less confident about being involved in decision making than those people living in less deprived areas. That's a crucial one for how we gain our community insights, because if we're looking to gain community insight that can reduce inequalities, then how are we making sure we're getting the insight of those that are less likely to want to have the confidence to get involved? And our Masterclass 3 on data will do a deeper dive on how that can be done. So rather than go through, as I say, all of the individual wordings and the evidence, I wanted to just focus a little bit around the fact that within any of the outcomes, what we can do is take interventions and make interventions to address the amount to which we're meeting each of the place and well-being outcomes in our places. The graph below the visual just looks at the different themes of the place and well-being outcomes and looks at the kind of interventions that we deal with day in, day out, the provision of segregated walking and cycling, looking at the provision of natural space and multifunctional green space, the provision of health centres, leisure centres, our access to resources. Every one of those, as we map across, impacts on behaviour change. That is the ultimate difference that it makes our places as we move through them. We can increase our physical activity, our interaction with nature, our use of local amenities, improve our social engagement, our community cohesion, and actually find that we don't need to buy that car or that extra car and can reduce our travel costs as well. And the impact of each of those is to see improved health outcomes, both physical and mental, improved planetary outcomes as well, and where we are taking account of the inequalities in our area, improved inequalities as well, and a lessening of them. So just a final one to look at that triple win and the impact that a place and wellbeing outcome intervention can have. Again, back looking at an intervention that's looking to improve access to natural space and multifunctional green space, one I think we're more aware of as being something that improves our health and well-being. So in the middle, you can see the list of things that are impacted by making sure that everybody has access to good quality green space. But also on the left-hand side, we can see the impact that's also can be having for our climate and our ability to meet net zero. And then on the right-hand side, we can look at the impact that it can be having for those experiencing inequality, that it's improving community cohesion, providing benefits to local economies, and is improving people's ability to contribute to the economic environment. If you're fit and well, you're productive. If you're cognitively feeling good, you're productive as well and feel more able to take part in social and economic life. So if we've got all of that, then what we have is a set of answers and means and interventions that are well proven to help us to deliver on a full raft of different ambitions that we're being asked to deliver upon right now. And the top third of 2/3 of that screen is just a couple that I've plucked out that we are working on. There are many more that the role of place and the places that we live, work and play can help us to be delivering upon. Maybe not immediately, but preventatively, thinking upstream. So it's very much about thinking about the Christie Commission principles, about prevention and working in partnership on delivering these outcomes. And it's also delivering for everybody around aspects and asks such as the place principle, the social determinants of health. The place and wellbeing outcomes are the way and the means to actually deliver around those and take that long-term preventative approach around place. Before I finish on what they are and how we've been and go on to how we've been using them in shaping places, I just wanted to highlight that we also have a set of place and wellbeing outcome indicators. These are developed, but we will continue to develop them. We're not saying by any means that they're finished. We are it is a work in progress, and we are also working on how we build them into an easily accessible dashboard. But they are there at the moment on the Improvement Service website. And the links to that will come up at the end of my presentation. So this is a core set of indicators that can be measured and reviewed over time to assess the contribution to the delivery of the place and wellbeing outcomes. So essentially being able to measure and review our delivery of a place where people can thrive. So keep your eyes open and peeled on those, because we will be developing those as we progress with the place and wellbeing outcome work. Finally, there is a resource again on the website a briefing paper about the place and wellbeing outcomes that gives much more background and gives all of their wording. As I say, those individual place and wellbeing outcome briefings are up on the website as well. So I would encourage you, if you wish to know more about them, that there is a lot more up there. But I'm going to stop on the content of them now to just go in and give a little bit of insight into how we've been using them in the Shaping Places for Wellbeing programme. Give a feel for that, and as I say, very keen to hear if others have been using them and how. So the Shaping Places for Wellbeing programme was really came into being in order to look at how to embed those place and wellbeing outcomes into local systems. We started with that overall ambition back in 2021 to improve Scotland's wellbeing while reducing the significant inequality in its health of its people and to address the health of our planet. So the triple win was an important aspect for us. And along the bottom there is about the embedment of the place and wellbeing outcomes to create system change and local processes in order to have those embedded. How we did that was the activities that sit in that blue middle band. This was the action that we took part in. So the programme itself was funded by the Health Foundation and the Scottish Government, and that enabled us to go in and work locally in 7 project towns and to provide staff on the ground to do that, a project lead and a community link lead in each town. So that was an important part of the activities and in our use of the place and wellbeing outcomes. But it's important to also highlight that the other 2 activities there were equally crucial for us. The local learning cohort, where we could bring together those working in all of the project towns to share, reflect, learn and produce how-to guides on what we had learnt so others could replicate, is absolutely invaluable to the process of the Shaping Places for Wellbeing programme. And then equally, we had a national leadership cohort with the organisations you can see on the screen, where we could meet with quarterly with any national barriers that we were seeing to progressing that local place-based approach work. So going back to that place-based approach work that I was referring to earlier and those three key elements, for the Shaping Places for Wellbeing programme, that did mean that the place and wellbeing outcomes sat there central under that place element. What we used that to do, actually, I'm just going to flick slightly back one. So what we used primarily the place and wellbeing outcomes to do was to bring them into the decision-making processes in those local towns that we were in and working with. So obviously bringing the data about people was important, but bringing the place and wellbeing outcomes and what matters in a place and how our decisions are impacting on our places was crucial. And the primary way that we did that was through place and wellbeing assessments and using briefing papers as well. So quickly, the final Masterclass 4 will go into a lot more detail about a place and wellbeing assessment and how you can bring the place and wellbeing outcomes into your decision making. What that process was very quickly was looking at plans, strategies, proposals, frameworks that were coming up under review and asking, while still delivering on the ambition of that framework, how it was also contributing to all of the other place and wellbeing outcomes, how it was contributing to the population groups most impacted by inequality, and what could be done in the content of that plan to improve its impact on all of the place and wellbeing outcomes. That impact goes across over 30 place and wellbeing assessments that have been undertaken by the Shaping Places for Wellbeing programme, a range of scale from neighbourhood plans to up to the NHS Forth Valley Healthcare Strategy. So a full range of geographies where you can apply the place and wellbeing outcomes. The other thing, just to bring that one to life, one of those was around the Dunoon Active Travel Hub plan. And I just want to bring to life how when we're using the place and wellbeing outcomes, it's not just about one outcome. You would assume an active travel hub plan that you would think, oh, well, it's delivering on active travel. So there we go, it's delivering on that outcome. The importance of delivering on other outcomes comes through when you look at the things that were discussed and the content of the plan, that looking to increase access to walking, wheeling and cycling is also improving public transport and access for the Dunoon Active Travel Hub to the ferry being the biggest bit of public transport. But there's also a role towards play and recreation. Providing space for people to come together is improving on the outcome around sense of belonging, the outcome on services and support, and on streets and spaces. Getting volunteers involved in the refurbishment and using traditional skills contributes to work and economy and again to sense of belonging. Moving around to the green box, improving the welcome to the town by upgrading and celebrating heritage again is contributing to a range of outcomes and this time including feeling safe because it was a derelict building right next to the ferry terminal. And then the final orange box, the collaboration between the council and the community organisation with local knowledge is significant in contributing to that outcome on influence and control and sense of belonging. So how we do these plans and that we include all of these elements contributes far wider, has that opportunity to contribute far wider than to what may seem like the obvious outcome that it could be contributing to. The other way that we used our place and wellbeing outcomes was to do more local place and wellbeing outcome briefings. So as I was saying earlier, we had national ones up on our website that you can look at, but we also pulled together the quantitative and qualitative data along with the evidence behind the place and wellbeing outcomes into briefings for our project towns. And these could then be used and inform both elected member training, committee reports, funding applications. They informed the setup of groups coming together to promote active travel and to work together on them, because you had all of the information and evidence-led decision making at the touch of a hand. So I would encourage you to have a look at those and the ability to pull things like that together locally for yourselves as well. So what do we feel have been the impact and the shared learning for us on the Shaping Places programme? We capture a lot of impact stories on our website, but I would like to just draw out some in particular about the place and wellbeing outcomes, and starting right up a top scale down to a more local level. So Aberdeenshire Council are using the outcomes as part of their place strategy. We began working with them in Fraserburgh. They've applied that strategy across the whole of Aberdeenshire and are embedding the place and wellbeing outcomes into that work. Similarly, South Ayrshire have embedded the outcomes into their council plan and have just recently embedded them into their local outcome improvement plan as well. More locally, Dalkeith Local Community Plan is structured around the place and wellbeing outcomes. And then more local again, Ayrshire and Arran Health Board are using the outcomes to structure their consultation responses to planning applications. So I just wanted to give some examples of where we have had an impact on the place and wellbeing outcomes being used, but also that range, that scale of geographies across which they're being used as well. A final area that I would like to highlight where they've been used as well is in the work of the National Planning Improvement Framework. So that is looking at the attributes of a high-performing planning authority, and one of those 5 attributes has been identified crucially as being place, and they are using the place and wellbeing outcomes and looking towards the place and wellbeing outcome indicators as they progress, helping planning authorities across all of Scotland to deliver on being high-performing planning authorities. Our website has a lot of wow moments and testimonial quotes. I've picked a very short one here for the sake of this presentation, but this one really does reflect well on where we feel the place and wellbeing outcomes have benefited us in the Shaping Places for Wellbeing programme, in that they've given a good framework and they're starting to have an influence from a strategic perspective. That is that difference with a set of outcomes, that they come right up to a very high level and being able to see the strategic outcomes that we're wanting to deliver in an area. So moving forward for ourselves and how we can be helping with the place and wellbeing outcomes, as I say, we have a lot of website resources sitting there under the Shaping Places for Wellbeing programme and under the place work on the Improvement Service website as well. We're also running a national learning cohort. This Masterclass series is part of that. And for the next, for October, November 2024, we are even able to give bespoke support on how to use those place and wellbeing outcomes in a place and wellbeing assessment also. There is also on the K-Hub, if you have access to that, the Shaping Places for Wellbeing programme has an evidence-based area in there where you can go in and view all of the evidence per outcome as well. And as I say, what we're moving forward to do as that middle band of learning is further masterclasses, looking at what's happening to people and how to delve deeper into that, the importance of not just quantitative data, but community, insight and qualitative data, and then looking at decision making. And then in the new year, we'll be looking at how do we look at place-based approaches in action. Who's using our approach, the Shaping Places for Wellbeing approach? Do you have an approach you want to get in touch and share about? And we'll be looking to share actual practical actions that are using the place and wellbeing outcomes as well. What is next for us is to expand and enhance those place and wellbeing outcome indicators. Work is ongoing on that. We're also working to scale up that understanding and use of the place and wellbeing outcomes, and we're giving strength and support to planning authorities on that as they have their local development plans and evidence reports, and we are evidence-led with the use of the outcomes. What can all of you do? Having listened to this, I would suggest expanding your understanding of the role of the outcomes. Have a look at the website, have a look at each of the outcomes and the evidence, the actual briefings that are up on the Improvement Service webpage now. Share this masterclass, share the other masterclasses if you've watched them with others so that they have that understanding as well, because we can't work collaboratively on a set of outcomes unless we all understand them. And then finally, embed the outcomes into the strategies, the plans and the proposals and the frameworks that you're working on at the moment. And you do that by taking a place-based approach to your decision making, by including the outcomes and by looking at the other aspects of a place-based approach that will be covered in the other masterclasses for this series. So those are the links, and obviously we'll be sharing this presentation for everybody to capture those and to be able to get further information. And I thank you very much for your time.